and clear. So ideally we make vascular space All right, your patient presents with decreased appetite, a fever, a productive cough, shortness of breath, sharp chest pain that gets worse with inhalation, and shallow breathing. What could it be? If you guessed pneumonia, you're right. Pneumonia is infection of the lungs, usually caused by bacteria or a virus. The infection affects the lower part of the lungs and causes swelling. The tiny air sacs in the lungs, called alveoli, can fill with fluid or pus. When this happens, oxygen cannot move into the blood as well as it should. This leads to low oxygen levels or hypoxemia and can cause the body cells to not get enough oxygen. Some of the signs and symptoms your patient may present with vary depending on the cause and the patient's age. However, this patient usually looks sick and may complain of fever or chills. So look for a feeling of tiredness or weakness, a decreased appetite, a fever which may not be present in older adults, a cough which may or may not produce mucus, shortness of breath, the tachypnea, tachycardia, sharp chest pain that gets worse on deep inhalation, shallow breathing, or maybe even holding or splinting their chest because of the pain. Your patient may have crackles, wheezing, or rhonchi heard with a stethoscope. Your patient may have confusion or altered mental status, and this is especially concerning in older adults. Sweating or diaphoresis, a bluish skin or lips indicating cyanosis, and oxygen saturation less than 94%. You should treat any patient you suspect of pneumonia as any other patient who's having trouble breathing. Focus on ensuring the airway is open, the patient is breathing well, and provide enough oxygen. If the SpO2 reading is less than 94%, administer oxygen to titrate to effect. Pneumonia is usually caused by infection and does not normally cause severe airway tightening or bronchoconstriction. Because of this, patients may not have inhalers like albuterol unless they also have another comorbid disease such as asthma or COPD. So only consider bronchodilator medications if there are clear signs of bronchoconstriction. Always follow local protocol and contact medical direction if needed. CPAP is very useful in these patients and may be allowed by protocol.